Hello, good morning, everyone. Happy Monday. Happy Mental Health Monday. Welcome back for another week and another month and another day and another week to continue talking about how to take care of our mental health. Welcome back, everyone. I am so excited for this topic, for this series. Like I mentioned to you guys last week, I am going to focus I say the whole month, but I think I'm going to be here until the end of this year because my list is so long to be talking about children mental health. There's so many different diagnosis under children mental health, and there's so many different things that impact children that I wanted to focus on for the rest of the year, because I know there's some Mondays I'm going to miss because there's going to be some holidays, and there is not that much Monday in the end of the year. I was counting how many Mondays there is in the end of the year, and it's not that much, and my list is long. I am so excited. Welcome back, everyone. If this is the first time you have get to my channel, do not forget to subscribe, because once you subscribe, it will give you an alert every time I drop a video, and as well it will be easier for you to find me. You can listen to me anytime that works for you, so you don't have to go search for me. And of course, it's a way to support me. The more you subscribe, like, and comment and share, the more people that can find this channel, guys. So I'm asking for your help to help me, because I have so much planned for this platform. I have so much, this is just the beginning. I have so much to say and do here that I would like more people to find us. Welcome back. I am so excited. Oh my God. I am so excited for the rest of the year, because it's going to be good. It's going to be good. Sadly enough, today I start with a very common, very popular, and very vanilla topic, but I did that on purpose. I'm getting all the boring things out of the way so we can get to the excitement things. Don't forget to like, subscribe, and share. Before I start with my topic for today, I always ask you guys, what did you guys do in the last week to continue taking care of your mental health? What did you do? I normally encourage you to implement something, either every day or once a week, something to continue taking care of your mental health. What did you do? I don't know about you guys, but since I've been speaking about boundaries, I've been using boundaries a lot. And that's what actually I did last week. I was one of those individuals when I was getting something done, either my hair, my eyebrow, waxing, my nails, whenever I'm getting some things done, or even restaurant, getting food, different things like that, I normally don't have any voice. If, let's say, I order a food and the food didn't come right, I eat it. Although I don't like it, I was like, oh, it's not right, but I still eat it. Let's say I get my nails done, it's something I didn't like it. I don't like the way they do it. I don't like the shape, things like that. I used to not say anything. But last week, I stand up for myself. I say something. I was getting something done and I did not like it. And I was like, oh, well, I thought it was going to come this way. I even grabbed my phone, showing the pictures that I wanted to look like. And then the person's like, oh, let me see. And it was such a great relationship, because again, boundary help you with healthy relationship. So when I was able to, to communicate, to have a voice, to explain what I like and I didn't like it, the individual was able to correct it for me. The individual asked me, what do you think? Do you like it now? And then they were so happy that I end up liking it. And I was so happy that I end up liking it. And when I go home, it didn't stay with me. Because sometimes if something happened and I don't like it, I will spend maybe a good 30 minutes of my life and be like, oh, I didn't like it. Oh, I should have done that. Oh, I should have said that. Oh, why? That's 30 minutes of my life that I could have done something else. But that happened. So that's what I did. I used boundaries. Like last week, you guys. I used boundaries. That's what I did to continue taking care of my mental health. What about you guys? What did you do last week to continue taking care of your mental health? Let's get into it, because our goal, it's never a long video. Let's get to it. So today, the topic that I have for you guys for today, it's a very common topic. It's a very misdiagnosed topic. I almost feel like people in the United States romantic this mental illness. Everyone wants to have it. You hear it so many places. And that is ADHD. ADHD, which stands for Attention Deficit Hyperactivity Disorder. That's what ADHD stands for. Attention Deficit Hyperactive Disorder. I remember when I first started as a therapist, I will be going to people's home and I will be doing a diagnosis, and I'm like, no, your kid is not ADHD. And then the mom is like, no, my kid is ADHD. I'm telling you, my kid is ADHD. It's like everybody wants to be ADHD. Everybody wants to have ADHD. Everybody, if something is happening, they're like, oh, I am ADHD. I must be ADHD. Like, it tore around so much, and it's been misdiagnosed so much. I do not think the amount of people that been diagnosed with ADHD, it's really ADHD. I do not, professionally, I do not believe it. And I will explain why. So, ADHD is one of the neurodevelopmental disorder that we have. So, in the neurodevelopmental disorder, we see intellectual disability. We see communication disability. We see tic disorder. We see autism. We see some specific learning disorder. So what is a neurodevelopmental disorder? So a neurodevelopmental disorder, it's attacking, it's a brain issue. It's a brain issue. It's a nervous system issue. It's a spine spiral issues. It's something that's happening in our brain that is not developing. So something's going on and our brain didn't develop. So and don't worry, you guys, some of those things that's under the neurodevelopmental disorder, I am planning to go over them. I am planning to talk about tic disorder. I am planning to talk about autism, which is one of the big other ones now. I am planning to talk about some specific learning issues. I am planning to talk about intellectual disorder. I am planning to talk about those things. That's what I say. I'm going to be here for the rest of the year. But today, I want to grab one of them, which is the Attention Deficit Hyperactivity Disorder, the ADHD disorder. So what is ADHD? The way they define ADHD, and you can break it down exactly how I said it, it's when a child or adult, because we see it in adult, but it's when someone having a hard time to paying attention, and then they're also having, they're also having a hard time to sitting still. So I will give you guys the DSM-5, and if you don't know what that is, go listen to my other video because I explain what DSM-5 is. One day I'll show you mine, all broken and things like that, but I use it so many times. So in the DSM-5, the definition of ADHD is ADHD. It's a neurodevelopmental disorder characterized by persistent pattern of inattention, hyperactivity, and impulsive that can impact daily activities, can impact your academic performance and social interaction, and it's actually affect your daily function and developmental. That is the definition of it. So what does that really mean? So, ADHD, it can impact every aspect of your life, We normally see it in the social setting. We are normally see the kids having a hard time in academic development. We also see it in their work. We see it everywhere. Now, with ADHD, you have to see it in two places. You cannot see a child that at home, the child is all over the place. However, at school, they follow rules, they're great, they're doing great. No, it have to be in at least two settings. Or you cannot see the child at home, they are beautiful children, but at school, they're all over the place. Or at church, they're all over the place, but at home, they're following rules. It won't be like that. It have to be in two different settings. And it also have to impact certain part of that kid's life or adult, like I said. Because ADHD sometimes can be diagnosed. We can see it in a kids that like close to 3 years old. It can be, some kids can be diagnosed at 3 and up. Most kids diagnosed with ADHD under 12 years old. That doesn't mean you do not see it in adult. It's just that there's a very small pool of it. And again, a lot of adults that diagnose themselves with ADHD, they are not ADHD. Because what you guys making so big is not as big as it is. Now I feel like it's like in the population, it's like almost 50% of people in the population have ADHD. That can't be that true. And I will explain why it can't be true. So, ADHD cannot be a kids went through any type of trauma. Because sometimes we see ADHD symptoms when a child or an adult went to certain trauma. If you went to a certain trauma, it's impacting your brain. It shows as a symptom of ADHD, but you don't have ADHD. You just have symptom of ADHD, or you have something else. Let's say if the kid's having a hard time at school, they don't know how to read, they don't know how to write, they have a hard time at school, and then they're like, oh no, they're ADHD. No, they might have a specific learning issues. It's not ADHD. Substance use. We see a lot of individual who is in addiction, who have a substance use issues. They are showing sign of ADHD. That doesn't mean you are ADHD. There is a lot of kids, lack of parenting, lack of guidance. Sometimes that kids can show sign of ADHD. That doesn't mean that kids have ADHD. There's some kids that, like they look impulsive, they look hyperactivity because they are bored. There's some kids it's because they don't have no guidance. There's some kids it's because they are eating bad food. There's some kids because they are not sleeping well. There's some parents are saying that their kids are ADHD because they don't have no patience for that child. They believe the kids need to be, like in a form. Sometimes, like, in my clinic, like let's say these parents come to the clinic with this child and they're spending 5 hours and they're expecting this 3-year-old to sit in a beautiful chair quietly, silently, in order. And they're like, oh yeah, he's so ADHD. No, they don't have ADHD. They were bored. They've been here for 5 hours. So there is some stuff that is normal child behavior. And then there's some stuff, it's because of something else. But that doesn't mean they are ADHD. Now, in the ADHD, there is two different parts of it. And in the word itself, you see the different part. So one part of it is the inattention part. So the attention deficit, the inattention part. And then those are, you will see kids like they're not detail oriented. They can't focus. They can't follow direction. They're having a hard time paying attention. They're forgetful. Like you can tell them to do some things and then it's like they forget it. Like, like in a second. Even if you speaking to them, they don't seem like they're hearing you. They don't seem like they listen. They have a hard time following guidance. They have a hard time following instructions. They have a hard time following directions. Those kids, and then that's why it's impacting their schoolwork. That doesn't mean the kid have intellectual issues. It's just that because they can't pay attention, they can't focus, they can't hear you, they're not there, then they have a hard time with the school. They have a hard time completing their homework. They have a hard time finishing their tasks. Or if they finish the homework, it's like so much detail missing. Like you can see this kid even misspell their name, like nothing is finished, but they're finished. And to them, to them, it's like, I'm done. Those are the kids, like if they sit down to color, they go, they're like, I'm done. Next. It's like they're not going to be sitting there and coloring inside. No, that's not going to be the kid. And the other part is the hyperactivity and impulsive part. And those are the kids that's very restless. Those are the kids that they always have to be moving. They're very fidgeted. They're all over the place. They talk a lot and excessive. Those are the kids that's like, they always have to be moving. They're all over the place. Like if they sit, they have to be touching everything. Even if they sit, like, they're like squishy. They're like, like you will see them like that. And like if you asking a question, they're always like, me. Like it's like they can't even wait for you to stop. Those are the kids that have that. Now, granted, the ADHD, you can see some kids fall into a lot. You will see some kids fall into the inattentive, but not really the hyperactive or the impulsive. Or you can see some kids fall into the hyperactive and impulsive, but not the inattentive. Or you can see the kids combined, like they have both. And let me tell you, those kids are fun. The one that have it both, oh my Lord. I have met true ADHD. There's some kids in my line of work, when you come in, it's like, okay, yes. But again, there's a lot of kids that people are saying that's ADHD. They are not ADHD. There's some of those kids, they just need guidance. They just need parenting. They just need routine. They need structure. They need to eat better. They are bored. They need, they need different things. And with ADHD, it's been diagnosed a lot in boys because, yes, boys are different than girls. Boys, it's not easy for a boy to just sit there and play with their toys or door and then brush the door. No, boys don't do that. Boys like destroying and climbing and things like that. So a lot of boys, especially these days, they've been diagnosed with ADHD. No, they've just been boys. Until this day, scientists doesn't know exactly what's causing ADHD. Some science will say it's the food. Some science we see it a lot in genetic. Like let's say if I have ADHD, we see it easily for the kids to be ADHD as well. So it is genetic. It's the environment that they are in, and then it's the food that the kids are eating. But the true brain, no developmental child, that part of their brain did not developing, it's a very small percentage of kids that is ADHD. And of course, there is different way of treating ADHD. One of the way it's medication. Kids can start banning medications as early as 6 years old when they're diagnosed with ADHD. I do not recommend it, but a lot of kids are, especially if, it's the combined type of ADHD. Sometimes it's needed. And another ways of treating ADHD, it's behavior therapy. So it's therapy, but it's a different type of therapy. It's behavior therapy. And behavior therapy, what we're really teaching the kids is practicing. There's a lot of practicing. There's a lot of techniques. And we are giving the parents a lot of guidance, a lot of structure, a lot of routine. We're encouraging the parents to connect the kids to sports, to have structure in the home, to have routine in the home. And at the school, they're also sometimes providing some type of assistance. Another way, it's lifestyle change, and I mentioned it. So there's routine, there's a time to sleep, a time to eat, a time to play, a time to go outside and go play sports, certain things the kids are eating, healthy diet. Those are one of the ways of treating ADHD. And I say treating because ADHD is not curable. You cannot cure ADHD. Sometimes it went off. If, let's say, you were a child and you have ADHD, and then when you become an adult, it's not as severe as it was when you were a child. But I have seen some child, they were severe as a child, and then they become an adult and it's still severe. Some child I see, they had ADHD as a child. When they become an adult, it's mild, like you barely seeing it. And then there's some people that was not diagnosed as a child, but they end up diagnosed as an adult. So we see this illness in both children and adult, but mostly it's been diagnosed as a child. How would you find out if your child is having ADHD? So if you suspected, from the list I just mentioned, or even you Google it and then you feel like your child is ADHD, or you see some symptoms, the best way sometimes the school evaluated the children to see if they are ADHD. Sometimes if you go to the child doctor, they can refer you out for that kids to get a psychiatrist evaluation. Sometimes they get a neurologist evaluation, or a psychologist evaluation, but they will get a evaluation and then they will get diagnosed. So if your child do get diagnosed with ADHD, you can take that evaluation, you take it to the school, and the school will create an individual educational program, which they call the IEP program, at the school, so they can assist your child so your child can do better at school academically. Because like I say, ADHD can impact everyone's daily life. It impacts their work, it impacts the school, it impacts them at home, it impacts them in social interactions, it impacts them with relationship with themselves, with other individuals. So it impacts their daily function. So at school, a lot of kids, you do not want them to fall behind because they do not have academic issues. They just have attention issues, and they have hyperactivity issues, and they have impulsive issues. It's not mean they are dumb, they can't learn, they can't read, they can't write. ADHD kids should never not be able to succeed in school. They just need to learn differently. And then at the school, they can create an individual educational program for them, so to keep them in the same level as other children. If you do have a child that's truly ADHD, there's a lot of work for you, because like I said, the child lifestyle needs to be structured. You need to learn, you need to educating yourself, you need to stay in communication with the child teachers. There's therapy that needs to be happening, and some kids do need medication. I remember a kid that I came in, and that was one of the kids in my whole lot of work. I can count in one hand how many kids I'm like, no, this kid needs to be in medication. That was one of that kid. Oh my God. I went to this kid's school because I used to like that anyway. So I used to do therapy at their home. But what I used to do, I used to want to see that child everywhere. So I wanted to see him at home. I see how he looked like. He's showing me symptoms of ADHD. And I went to his school so I can see his behavior. He was in first grade. And oh my God. So his class used to have like a mirror that I could watch. This kid was all over the room. He was all over the place. He was touching everybody. He was going there. He was everywhere. And then the teacher was like, sit down, and he was all over the place. And I remember after 3 months doing therapy with this child, I'm like, Mom, he needs to be in medication. Like, he needed badly. Like, he needs to be in medication. And after he was able to get a low dose of medication, he was able to be calm and he can learn what I'm teaching him in therapy, and he was able to learn at school too. So yeah, there's kids that it is needed, it's necessary, they need to be in medication. But there's some kids with therapy and a great lifestyle change, they will do fine. Or there's kids, they do all three: medication, great therapy, nice lifestyle change, parent changing, and they do fine. It is not, like I said, it is not an intellectual issues. It's a attention, hyperactivity, mental illness. So we always end our video with a dose of self-care. We're going to read our dose of self-care for today. Today, our dose of self-care, it's actually techniques that I actually teach people, especially to manage. I teach everyone it, but especially to manage, like to bring you back to the present, like to bring you back here. So I'll read it to you guys, and then after that, I will do it, and I will encourage you guys to practice it and let me know how it goes. Let's say, take a deep breath and let it out slowly. Take a deep breath and let it out slowly. So this is what we're going to do. We're going to take a deep breath. We're going to actually hold it a little bit, and then we're going to let it out slowly, like we're blowing in a straw. So when you're letting it out, you're controlling it and you're holding a little bit. You're going to breathe as much as you can. Hold it and let it out slowly. We'll do it again. Try it. This technique actually called deep breathing techniques, and there's a number to it. So sometimes you breathe in like for 5 seconds, you hold it for 5 seconds, and you let it out for 5 seconds. There's different numbers to it. I see 4-4-4 before, I see 4, 5, and 7 before. So you breathe all that air, you hold it, and you breathe it out nice and slowly and control, like you're breathing in a straw. Or end with it. Thank you so much, you guys, for listening to me today. Have a great Monday. I am excited to continue this with you guys. And please, please, please subscribe, like, comment, and share. See you next time. Bye-bye.